It's through the military. Welcome back to the New Nurse Guidebook channel. My name is Pierre Lafort, and if you're new to the channel, the purpose of this channel is to help new grad nurses live healthier, wealthier, more happy and fulfilling lives. Today, I want to talk about something that I know very well, and that is the Healthcare Professional Scholarship Program, or HPSP program, through the United States military. I'm going to be more specifically focused in on the Air Force and the Army because that's what I know. And more specifically, we're going to hone in a little more on CRNA, or Certified Registered Nurse Anesthetist, and using this scholarship to fund your education while serving your country. So, according to my research, there are two ways to do this. You can either do it in the Air Force or the Army branches. The Navy doesn't have an available program under the HPSP umbrella. But you might be asking yourself, Pierre, what the heck is HPSP? I'm glad you asked. HPSP is a scholarship program where you get accepted to a civilian program. For example, if you got accepted to Emory or Augusta University or National University or any university that publicly offers the CRNA DNP program, Doctorate Nurse Practitioner, you get accepted, cool. Then what you do is you go to the Army or go to the Air Force and you call up their recruiter. More specifically, you call up their healthcare professional recruiter. In another video, I'll show you how to find the healthcare professional recruiter. It's very important that you find the healthcare professional recruiter, not the enlisted recruiter, not the officer recruiter, not the ROTC recruiter, but specifically the healthcare professional recruiter. So you go to them, either Air Force or Army, and you say, hey, I'd like to serve in the service. Can I fill out a packet to do the HPSP program? Then you have to go through this whole lengthy process of filling out your packet. They are going to look through you with a fine-toothed comb. They're going to check all of your medical stuff. So make sure you have no medical abnormalities. And if you do, for example, I had an x-ray when I was a child of my back, and I had to dig up the old medical files and send them into them and then get evaluated by an orthopedic doctor to write a waiver. Even though I don't have any back problems nowadays, I still needed a waiver to jump through the hoop for something as benign as a back x-ray. So you need to make sure that your medical history is crystal clear, and if you do have things in your past, you better have great documentation of it, and you might need further evaluation from a practitioner. Awesome. So, what do you get out of the HPSP program? I'm glad you asked. They will cover 100% of your tuition, whether you're going to a bougie, expensive, luxury handbag private university, or you're going to a small, staying-at-home public university. Regardless, they will pay 100% of your tuition. You also receive a living stipend of $2,300 a month. And what you owe them back is a year-for-year commitment. So they cover 3 years of schooling, and you give them 3 years of service active duty. Now, when they say active duty, that means typically you'll be serving in a large medical facility like a hospital. From my understanding, as of the filming of this, more than likely you're going to get stationed in San Antonio, Texas at their large medical facility there. All military medical personnel go to San Antonio, Texas for training. I don't know the name of the base off the top of my head. And then the other two places you can go are Walter Reed in Washington, D.C., or Eglin Air Force Base near Destin, Florida on the Panhandle. So that's where you go typically when you graduate. This is, of course, what the needs of the military and armed forces are at this time, but that can change. So comparing the Air Force and the Army, Air Force as of 2024, according to my research, has 7 slots available, and the Army has 5 slots available. Now that changes every fiscal year. Sometimes they have a greater demand for CRNAs, so they bump up the number of slots they have available. And sometimes they don't have a big demand. And sometimes there have been years where they have 0 slots, 1 slot, 2 slot, 3 slot. It just depends. Typically the slots vary based on whichever CRNAs that are in the service, whether they're staying or they're preparing to leave and retire, and they need somebody to come in and take that spot. So 100% of your tuition covered, living stipend, and what you owe them is a year-for-year service obligation as a CRNA in the military. In the next video, I'll show a financial breakdown of the cost-benefit analysis of what you're getting out of the HPSP scholarship as far as scholarship finances and everything, and the salary and wage that you're receiving as a CRNA once you're serving active duty compared to if you were to take out loans and go the civilian route. If you found this video helpful, leave it a like. And if you know somebody else who would benefit from this information, please share it with them. If there's any other content you'd like me to make in the future, don't hesitate to leave a comment below and I'll add it to my docket. This is Pierre LaFour signing off with the New Nurse Guidebook. Thank you, and I'll see you in the next one.